Hi, my name's Amber Jath. I did my project on Crohn's disease, and the first thing I kind of want to go over is what happens when you have Crohn's disease, or what kind of causes that. So Crohn's disease causes inflammation in the digestive tract. Usually when you hear about Crohn's disease, you only hear about inflammation in the small intestine, but this can actually affect any part of the digestive system. And the disease is considered an inflammatory bowel disease. And then some common symptoms that you have probably heard of are diarrhea, cramping in the abdomen, weight loss, anemia, eye redness or pain, fatigue, fever, joint soreness or pain, nausea, loss of appetite, or skin changes. And then there's also some more severe symptoms that they would take a little bit more seriously. So that would be intestinal obstruction, fissulas, which are abnormal connections between two parts inside your body, abscesses, which are pus-filled sacs, anal fissures, ulcers, which can happen in the mouth, intestines, anywhere along the tract, malnutrition, since you're not able to keep most of the nutrients in that you're getting, and then inflammation in the eyes, joint, or skin. And then common ways to test for Crohn's disease would be first a physical examination by your doctor. They would kind of like feel around your abdomen region and test for any parts that have pain. And then they would move on to a blood test and a stool test. If they need to keep going, they would do a colonoscopy and an upper GI endoscopy. And then if they need a little bit further examination, then it would be diagnostic imaging, like a CT scan. And then they should be able to tell. So then some treatments for Crohn's. So there's no cure right now for the disease, and it's not a one-size-fits-all treatment plan. This is different for everybody, but some of these can lessen the symptoms and complications that you're having. So first thing is diet changes. So they typically will tell you first to keep a food journal. This will kind of rule out any of the foods that are causing symptoms. And they say avoid carbonated drinks, avoid popcorn, vegetable skins, nuts, anything high in fiber. You should start drinking more liquids. Your water consumption should be calculated off of your body weight. And then eating smaller meals and just eating more often. So if you did 6 small meals a day instead of 3 big ones, and then it helps identify food that is causing them. So sometimes people need less fiber in their diet and sometimes they need more. There's really no indication. And then a bowel rest. So a bowel rest is usually when your doctor will ask you to not consume any solid foods. They'll put you on a liquid diet. They will either prescribe the liquid for you that has nutrition in it, or you'll do things at home like chicken stock and stuff like that. It can either be done in the hospital, depending on the severity, or you can do this at home. And this can be anywhere from a couple days to a couple weeks. And then medications. So there's a couple different medications that they prescribe. So the first one would be aminosaccharides, which help control inflammation, and they're usually prescribed when people first are diagnosed with Crohn's disease and the diet changes and bowel rest didn't help. And then if that doesn't work, they'll move on to corticosteroids, which reduce activity of the immune system and decrease the inflammation. This isn't recommended for long-term use, and there's a lot of side effects to this, such as changes in your blood glucose levels. And then if that doesn't work, they'll move on to immunomodulators, which help reduce the immune system activity and then cause less inflammation in the digestive tract all along it. It usually takes a couple weeks to a couple months to start working, and this is usually a treatment that they give for someone to go into remission. And it's usually given when no other treatments are working. And then the last thing would be biologic therapies. So these target proteins made by the immune system, and it neutralizes the proteins and causes them to decrease inflammation in the intestines. This will also help them go into remission, and it's kind of like the last treatment plan for medication. And then surgery would kind of be for any of those symptoms that are more severe. So like the fissulas, the intestinal obstructions, anything like that. It's not super common, but it can happen. So who's at risk? So anyone in your family, if they have Crohn's disease, you are more likely to get it. If you are a smoker, you're more likely to get it. Some common medications, such as birth control, antibiotics, and anti-inflammatory medicines can cause you to get Crohn's disease. And then if you have a high fat diet, sometimes that can cause it. So what causes Crohn's disease? It's unknown what causes it, but they have done some research, and right now it's inconclusive. So they believe that it's a bacteria that gets into the digestive system that is developed from your genes, and then it triggers the immune system to act wrongfully. So since it's linked to family history, usually it trickles down the line and it's in your biological makeup. Okay, so the effect of Crohn's disease on exercise. Crohn's disease usually comes in waves, and you have flare-ups when your symptoms are worse, and sometimes they die down. Usually this can be like if you're making dietary changes. So when one's experiencing a flare-up, it's recommended that they don't exercise until the inflammation has gone down and your cramping and pain has gone away in the abdominal region. It's important to just stay hydrated and maintain your consumption of nutrients. And then if at any point during the exercise you're dealing with some discomforts or pain and any intestinal movement, it's best to just avoid exercise until that pain goes away. And sometimes Crohn's disease can have an impact on your joint function, so it's best to start with low to moderate intensity, just like walking, cycling, swimming, yoga, anything like that. And then they don't have a specific program for people with Crohn's, but they just recommend your typical fit program. Okay. So there hasn't been many studies done that show that exercise helps Crohn's disease. Everything has been considered invalid, and they haven't done many other studies aside from that. So there was 2 that I found, and they basically said that there's a correlation with Crohn's disease and having anxiety, depression, and stress, so that exercise helps your mental state. But there's nothing really linked to the actual disease itself. So it's a recommendation specifically for those with Crohn's disease does not exist. There has been limited studies on the exercise effects on those with Crohn's. In those limited studies, there has been some correlation that can't be proven that exercise can protect against the Crohn's disease. Depending on the intensity of the exercise, though, it can irritate symptoms, so it's best to start with low to moderate intensity. So I talked about some of the medications that they can recommend, and one of them has a side effect of high blood glucose. So it's best to start the program taking this medication so they can see how it affects you as you're exercising. And that's something that you would need to maintain for your client or patient. So same thing as the hypertension, you would do the 15-15 rule, depending on what symptoms they start to show once you start your exercise. And then medications can help limit the severity of symptoms that you experience during exercise with Crohn's disease. So my case study is actually a family member. So it's an 18-year-old female who recently was diagnosed with Crohn's disease. They have no other health concerns. Right now, their fitness status is less active, just being symptomatic, but they're out of season of their sport. They're an athlete, and they're currently not taking any medications. They're just monitoring their diet at the moment. And then their goal is to return to being physically active. They're usually physically active 5 to 6 times per week. So they want to get back to that. They want to increase their cardiovascular endurance, increase muscle strength, and increase their vertical. They don't need any pre-clearances to performing activity, so we can move ahead with their testing. Since the client's been previously active and is a current lacrosse athlete, I chose these exercise tests to reflect on their current fitness experience, but also their current condition. So their body composition, they're female, their height is 5'4", their weight is 132 pounds, and then their BMI is average, their body fat percent is average, blood pressure was good, normal range, and then their heart rate was also normal. So for the muscular fitness test, we did a 1 rep max squat. It was at 90 pounds. Since she is not in season and has not been engaging in her regular training program, we kind of bumped that weight down just a little bit there. And then same thing with the upper body strength test. So we did a 1 rep max bench press at 45 pounds, just the bar. And then the muscular power, we did a vertical jump, and right now her vertical jump is about 12.5 inches off the ground. So we're looking forward to increasing that. And then for her cardio respiratory fitness, we did the Bruce protocol treadmill test. So it went in stages with speed and incline, and then we had to monitor her heart rate using a pulse ox. And she also had her Apple Watch on just until it got to 85% of her max heart rate. And then her VO2 max was 36.2, which was considered good range for her age and gender. And then flexibility, we did the sit and reach test. So she was average, it was 14.5 inches. And then we did the back scratch test, which showed that she had a small restriction with her right arm compared to her left going behind the back. And then for her prescription, so flexibility is pretty good. There's not much more that would be required for her sport. So we're going to incorporate dynamic stretching into our warm-up, and then static stretching will be recommended to do 3 times a week. So static stretches are going to include hamstring stretch, quadricep stretch, abductor stretch, and then crossover stretch, which would stretch the hip flexor muscles. So this can all be completed with a stretch out strap from Amazon, and you can just do this like laying on the bed on your floor, easy in the house. So it should typically take like 10 minutes to do any stretches for your lower body, and you should try to hold those for like 20 to 30 seconds and then give yourself like a 20-second rest. And then static stretches for the arms, we're going to do crossover stretch, just coming across your body here, and then an internal rotation stretch since it showed a little bit of less flexibility on her right side, so behind the back with the stretch out strap. And that should usually take like 5 minutes. Same thing, you would hold it for about 30 seconds and then rest for 10 to 20 seconds. The dynamic stretches that we're going to incorporate in her warm-up would be walking single knee chest, walking quad stretch, hamstring scoops, butt kicks, and lateral shuffles. This should take about 10 minutes. She should do it prior to every exercise, aerobic or resistance, just to warm up the body and the muscles. And then, so for resistance training, we're going to begin 3 times a week, just because we want to see how the symptoms work with the intensity of the exercise. So we want to keep it kind of low to moderate intensity, even though she is an athlete. So since she's looking to increase muscular strength, we're going to do 3 sets of 5 repetitions and then 3 minutes rest in between each set. Since the client's experienced weightlifting, we're going to start with lower intensity 3 times a week, and we're going to do a duration about 30 minutes. So it'll be circuits. So we'll break it off into muscle groups. And when we're choosing a weight, we'll do about 50 to 60% of the 1 rep max, just to get the intensity later, and we'll see how the symptoms react. And then as the program goes on, we'll increase it. So the first circuit example I have is for legs. It would be goblet squats, Romanian deadlifts. You could advance those into single leg deadlifts if it's easy. And then we can either do walking weighted lunges or posterior lunges, and then split squats. And then aerobically, so the client is an athlete, but she took some time off. So we would do aerobic training at least 3 to 4 times a week. So it would be for about 30 minutes each time. And the type of aerobic activity would include indoor or outdoor moderate intensity walks, indoor, outdoor, moderate intensity cycling, swimming, or you can do the elliptical at a moderate intensity in the gym or at home if you have one. So this will increase as we determine how the exercise affects the symptoms of the client. So some precautions or modifications, exercise may cause flare-ups in those who suffer from Crohn's disease. So if this occurs, it's best to put the physical activity on hold until the symptoms lessen. If the client or patient is prescribed a variation of a corticosteroid, please be advised that the medication can fluctuate blood glucose levels. So sometimes you'll have to monitor that if that's an issue. If exercise causes any of the following, you should hold off on exercising until the symptoms stop. That includes nausea, dizziness, pain or discomfort in the abdomen. And then, so there's little evidence to prove that exercise significantly decreases the effects of Crohn's disease.